Hi everyone, I hope you're doing well and staying safe. I don't know why I'm very animated today, but it is what it is. I'm just trying to roll with it at the moment. Today is part two of my conversation with Ian Sadler. If you don't know Ian Sadler, I've posted links in my description in the previous video. Please do go check him out. He's given us students a surprise for the lectures that he participates in and the lectures that he does. So please stick around. Please use all the links that I've provided. Go check that out and let me know what you think. Like, comment, subscribe, share my videos, share Ian's videos. That would really help us all out. And yeah, we really appreciate all your love and gratitude. Thank you so much. Enjoy the video.
Um,
I remember you talking about stuff that you're built for and stuff that you're not built for in terms of I forget what you mentioned something. It was in relation. I think it was in relation to podiatry.
yeah, I think, I would observe in hindsight that lots of people who were robust to that sort of training
Hmm.
seem to have a certain foot type, certain build structure, certain musculature, and they're the ones that survived intact without having to augment in some way or spend lots of time training. But
Right.
equally, if you put them in a different environment, they'd probably struggle. So I think it's so essentially, work is the expression. Your genes have a capacity to produce bone or muscle or tendon or ligament, and then you cause them to produce that by
Mm.
putting workload through it. So the nature and nurture are both required at that point. And um, my nature responded very well to that type of nurture,
Mm.
if that makes sense. Whereas other
That does.
people's
Yeah.
didn't respond as well. And so there's another whole topic. I'm quite interested in the evolution of how we ended up walking and running and standing. So
Yeah.
putting together a lecture on that sooner or later because I'm definitely interested in
Oh,
it.
that's very cool.
Um,
Where will it be published? Or where are your
um,
lectures
uh,
published?
that one is still a work in progress, but
Okay.
we sort of advertise them on my. We've got a page on my clinical website where we advertise the training courses that we do. But yeah, so there'll be lists and things to sign up for if you're
Hmm.
interested in those.
Yeah,
Um,
that'd be great.
but where was I? Yeah, we were
Sorry.
hanging on about uh, training and load patterns and things like that. But yeah, so
Mhm.
that's kind of we went back to dyslexia. That's where we were heading, wasn't it? So
That's right,
um,
yeah.
yeah. So then when I went back to university,
Mm.
it was identified quite quickly that there was something going on, and I got dyslexia testing at university,
Hmm.
and that's where it was. They said that I'm a very strong audio learner. So
Oh,
I can go to a lecture, listen to that lecture, and I could probably repeat that lecture back to you at the end of it.
that's
Whereas
amazing. That's pretty
other
cool.
people need to go and look at their notes afterwards, whereas the notes mean very little to me. I can't learn that way very easily.
Mm.
So, it was coming up with strategies that once I had that information, it was coming up with strategies that worked for me because I had no idea how to revise. I had no idea how to get the information into my head from those formats that would normally work for most people, like the bite-sized revision and those sort of stuff, and the
Hmm.
memory cards that work for a lot of people. So I would say it's more of a differently abled.
Okay.
I can visualize four-dimensional anatomy in a way that other people can't, but then they can read quicker than me and absorb information from a book or a newspaper or something like that.
Yeah. I mean, that's actually pretty cool. I wish I could do that. So for just to reiterate, where did you go to find out what revision works the best for you? And this is for students, because I've spoken to a few pods that have said that they also struggle with dyslexia, but they found a way to work around it. So I
Yeah,
guess struggle is kind of, I'm using that word a bit too casually here,
yeah. I
but
think it's difficult because it's not what academia is commonly testing. So you've got to,
okay.
so academia is kind of set up or has previously been set up in such a way that it tests a certain skill set. So a bit like being a paratrooper tested a certain skill set, and I happen to be good at that bit. Other
Right.
people happen to be good at the things which are um, tested more. And certainly it seems to be more and more recognized, and there are different ways of testing. Even when I was at university, it was kind of like I had a little bit longer in the exam, but that was it. that was the thing. And I think there are now more provisions for those sorts of, depending on what your issue is.
Mm-hmm.
I've got a girl who's in the Army Reserve with me, who's, she cannot string a sentence together, although she's actually quite bright.
Okay.
But she's now studying to be a nurse, and she's about to go into her third year. So we talked about different strategies and things for her that have worked, but that was just a personal conversation.
Yeah.
So I was basically put in touch with someone who tested me in various different ways. I can't exactly remember what all the tests were. And then they, from that, they said, "Oh, that you're stronger at this and less good at that." And then I took that information and developed my own strategies from it.
So do you remember who tested you?
No, it was a chap the university put me in touch with. So it was through the university. So maybe the students' union or something like that would be a point of contact. But I went to Huddersfield, and I know some of the lecturers are still there at Huddersfield. So there's probably a pathway that exists. But no, I'm afraid that's too much water under the bridge to know exactly who that was.
Do you have any advice for students that have dyslexia that are studying podiatry?
Well, I think, try and find out what your strengths are and play to those. So, for example, when I found out I was an audio learner, I got myself a dictaphone and I read my notes to myself. So rather than trying to read them, I read them. And then after a little while, I realized that what I could do was play different music in the background.
Yeah.
That would trigger a memory for that subject. So I would play certain types of classical music when it was physiology, a different type of music when it was, or some metal or something. So I play different types of music in the background, and then you could that would trigger things for me. But again, that might not work for other people.
Yeah.
Another bit of advice I got from my brother, who'd been to university before me. So although he's younger, he went first because I did something else. He was sort of saying, don't keep rereading the same thing, because the temptation is to pick up an article, read it, go, that's interesting, put it down, and then you get a pile of articles which are relevant, but you have to read them all again to get that information out. And I obviously can't afford to do that.
Yeah.
Because it would take me too long. So his suggestion, which worked very well for me, was to basically look at the brief for whatever you'll produce, the assignment you're trying to produce. It will have a title and then some bullet points, which are the bits you have to cover. So that was what we used to get. I'm sure you probably get something similar for that. Set those bullet points out as headings, and then every time you read something that's interesting for it, find the heading it goes under and just put it down. And then immediately put that reference in your reference list. And as you continue to read through the article, every time there's a reference or a quote or something, you can just put it down and you've already got the reference in. So under the different bullets, you just form piles of references, piles of quotes. And obviously, if you then read another one that says something similar, you just add the quote after that. So that left me with a format of basically lots of information under that heading, lots of information under that heading, lots of information under that heading. And then all you've got to do is join them together into a sentence to make it work, if that makes sense.
Yeah, that does.
It was a way of doing it that worked for me. So I didn't have to keep rereading the same things and forming it that way. Does that make sense? So
that does,
they're probably the two strategies that I remember working quite well for me. Certainly the revision one worked quite well, because you could sort of play a tune in your head, which would help you remember the next bit, and then it just gets a bit boring hearing your own voice. So if you can find someone with a nice voice to read some of the things onto a dictaphone for you, but then they've got to read your handwriting. So,
Oh my gosh. I remember I always used to look up to my mom's handwriting, because her handwriting it still is, sorry, I don't know why I said was, it's still amazing. So her handwriting is it's clear. It looks very pretty. I don't know if that's the right word.
Okay.
And when I was younger, I would always mimic her handwriting to the point where right now, like, it's nothing similar. But when I was younger, I thought, like, for me, that was aesthetically pleasing. And I paid more. It was really weird, but I paid more attention when she wrote something down, as opposed to, like, let's say if my teacher wrote something down. And I don't know if that has anything to do with the way that I learn something. Is if I find it aesthetically pleasing, like it will stay in my brain a lot longer. I don't even know how my brain works sometimes. But yeah, the when you mentioned handwriting, I just like instantly thought of when I was younger trying to copy my mom's handwriting.
Mhm.
So I wanted to talk a little bit about your campaign. So what campaign is it that you're doing currently?
So I head up a thing called Pods Heals Heals, all right, or
Okay,
Pods Heal
it's quite a
Heals,
mouthful.
all right. Yeah, so we it's that's what we call it, but it's not exactly what goes out, and it came out of so it's essentially a grassroots campaign run by podiatrists to promote
Hmm.
podiatry.
Okay.
So I picked heel pain because it's probably one of the sexiest things we treat, and patients are the general public are only really
Yeah.
interested in us when they've got a problem and they're looking for us.
Yeah.
So if we want to talk to them at a time when they're not necessarily looking for us, it's
Hmm.
got to be something they might vaguely be interested in.
Right.
All right, so it came out of sort of really two events about 3 or 4 years ago.
Hmm.
I lose track because COVID's caused us to lose a year. So I think about 4 years ago now.
Yeah.
And I went to a meeting about ankylosing spondyloarthropathy, so essentially crumbly spines.
Right.
And they were developing, the rheumatologists were developing a um, new paradigm for diagnosing them. So you've got radiographic ones, which obviously you can
Right.
see on X-rays, and non-radiographic ones. And they were coming up with protocols to identify the non-radiographic ones.
Okay.
And what they essentially were looking to do was use. So basically, if you're under 40, females more likely.
Mm.
If you've got back pain that's unexplained and persistent and doesn't respond to normal treatment,
Mm.
plus one of lots of other things. All right, and if you want to look that up, there's a tool called the SPADE tool. So
Okay.
don't ask me to spell it, but SPADE tool. And yeah, but so you can just Google that and it'll show you what the algorithm is. But one of the
Right.
things is persistent heel pain, often bilateral, that doesn't go away.
Okay.
All right, so that can be a sign of this ankylosing spondyloarthritis.
Hmm.
And it was a room full of osteopaths, chiropractics, and some physios, and I was the only podiatrist there because it was
Mm.
a local thing. So I went along because it's something I'm interested in.
Yeah.
And at the end of the talk, of the lecture from the rheumatologist, several of the chiropractics and physios and things put their hands up and said, "This is really good because I've got lots of heel pain patients that I've had for years, and we've not been able to fix them. This might be the answer." So me,
Right.
as the token podiatrist, put my hand up and said, "Have you ever thought about a referral for podiatry if you've got these
Mm.
heel pain patients?" And they
Right.
hadn't thought of podiatry.
Wow. And
Right.
that's how
So
many professions in that room that didn't think of.
it was rheumatologists, primarily osteopaths and chiropractics with some physios. So
Right.
there probably were some others as well, but they were the ones self-identifying. And
Wow.
so it brought it home to me how invisible podiatry is really in the conversation around a lot of these things. We're
Oh
not
yeah.
necessarily.
I think.
I think our governing bodies do really well on the political level,
Mm.
but on the grassroots level of does the public know we exist?
Yeah.
You know, it's not something that we're necessarily that end up that aware of. The most
Yeah.
common question you get asked is, what's the difference between a chiropodist and a chiropodist and podiatrist? And you think,
Mm.
right, I'm not even going to bother trying to say it's actually chiropodist, not chiropodist. We'll forget that because that's forgotten anyway. We're podiatrists, and this is that argument.
Right.
So that was one part of it.
Right.
And then I went to the college or society, as was then, conference, and we had a couple of lectures where they were basically saying we're really struggling to get students in to
Hmm.
podiatry, and healthcare in general is struggling to get students, or it was at the time. Several of the schools were stopping taking first year students and possibly even looking at folding in the next couple of years. And we haven't got that many podiatry schools anyway. So it struck me that we kind of needed a PR campaign at that
Yeah.
point. So I postulated this to some of the Facebook groups and said, why is it that we don't own heel pain as a subject? And that got quite a
Mm.
lot of pushback because, quite rightly, we shouldn't own a subject. We're not the
Okay.
only people who can treat heel pain,
Sure.
but we certainly should be synonymous with it. If
Yeah.
we are portraying ourselves as the lower limb specialist, the foot and ankle pain specialist,
Hmm.
if you've got a foot and ankle problem, really, why are you going to your GP or your physio? You should be thinking podiatrist first. If you've got a knee pain, you think physio. If you've got a back pain, you think osteopath. Why aren't we there for those sorts of things? So that created a conversation, and out of that conversation came the fact that people didn't feel necessarily confident in treating heel pains. So, because you might have worked in a discipline that wasn't necessarily dealing with that a lot, and then if you've got the title podiatrist, suddenly you're going to get those. You might start getting those sort of things. So we put on a free or voluntary contribution conference. So we basically, out of my clinic, funded a hotel conference centre, and we just basically said, right, if you book it, they'll come. So we booked it. I think there were about 60 or 70 people turned up, and two other practitioners volunteered to help me run the day in terms of lectures. And then we got Jill Woods, and I don't know if you've come across, but she's a podiatry lecturer who now does marketing for healthcare.
Okay.
So she came along and told us how to sell the message. So we basically had some anatomy, we had some differential diagnosis, red flags, that sort of thing. And we had sort of rehab, because whatever clinical setting you're in, you can do some rehab.
Yeah.
Right? You might not have sophisticated insoles, you might not have fancy machines and things like that, but everybody can do some rehab. So we went through rehab principles for that. And then, like I say, Jill told us how to sell the message. So that's basically turned into a campaign that we run annually. So once a year, this year it's happening in March 15th to 23rd, so a 2-week period of March, where there are about 70 clinics around the country that will all be putting out the same messages about podiatry equals heel pain. Right? So we're not using plantar fasciitis, although that will come up a lot in the conversation, because that's the word that the public know.
Okay.
All right.
I see what you're saying. Yeah.
They can't say it, but they know it. So it's although clinically people would rather call it plantar fasciopathy, because it's not an itis and all the nuanced argument around that. But essentially, the public know the word plantar fasciitis. So my thinking is, you kind of got to talk to them on the language that they're using. Yeah. Be in the conversation, then you can gradually start to change it to what it should be rather than what it is. But ultimately, people have a heel pain, they want someone to fix it. They don't really care what it's called. Okay. All right. They're not that interested. They vaguely try and say plantar fasciitis, and then they just want to fix it. Gotcha. So yeah, we've put so basically this will be the 4th year I think the campaign has run. We've gradually been sort of growing it, but it's a PR campaign really. So each clinic promotes heel pain in its own way, but we all use the same messaging.
So how would students get involved in this if this is something that they would want to be involved with, which I mean, I'm sure they would actually really benefit from this.
Yeah. Well, I think there's probably 2 main ways. I would say the easiest way is follow, if you probably do anyway, but follow some on social media, Facebook, Instagram, whichever is your platform. Follow a few of your local practitioners, maybe someone who's given you a placement, things like that. Right. And when they produce content, like it, share it, and comment with at least 3 words. Okay. Because apparently social media likes 3-word or more comments.
The algorithm is so funny. It's so different for each platform. But sorry, I totally cut you off there.
No, well, if you know better, tell me. But yeah, so essentially, comment with some words more than just a thumbs up or something like that, because like I say, the algorithms rate these things differently. So a 1-word comment isn't a conversation. So Facebook wants conversations on its platform. So if you answer something or have a little conversation with the practitioner, that will boost that particular piece of content.
I know with YouTube, the like and dislike button doesn't really make that much of a difference.
It just hurts your ego, doesn't it?
It does kind of, because I literally have 10 subscribers, so it doesn't really bother me that much. I'm not crying, you're crying. But if you press either like or dislike, it just means that the video is getting views. So with the YouTube algorithm, the machine thinks that even if the viewer disliked it, they would have still seen at least 30 seconds of it, or maybe 1 minute or 2 minutes, and
Yeah.
it's still counted as a view.
Yeah.
So for YouTube, that's how that algorithm works. So
It's all good interaction for the
it
platform.
is.
It's time on the platform. So yeah, I think, or we'll be putting out stuff. So my clinic's BX Clinic, but you've got lots of different clinics are around that are putting out content. So if you like, share, comment on that, then that obviously grows the campaign.
Yeah. Okay.
And hopefully we get to your network, and then someone there might spread it, and so it gets out that way. There's videos being done. I've got explainer videos. Lots of Louise Reenie's done sort of mock TV news reports about it and things like that. So there's some fun stuff and some educational stuff and things like that coming out. I suppose the other way to do it would perhaps the other help students could give, because we'll make the assumption that a young student may well have more technological ability with social media platforms than some of us older podiatrists. So you could offer some social media support to them. So if you've got a practice nearby that you think actually they might be good at this but don't know how to get that information across, then that's something that you could perhaps do. But it's probably not something I would encourage a student to partake in at this point on their own.
Okay.
All right, because if you do get pushback from somewhere, it's much harder for you to defend yourself than someone who's been doing it for 20 years.
Yeah, that makes sense.
So, and there's no pretense that there's one treatment that works for heel pain. All right, you've got over 40 different differential diagnoses of things that are commonly misdiagnosed as plantar fasciitis. You've then got chronic and acute plantar fasciitis. You've got different levels of tissue damage, all those sorts of things. So it's not defined very well. So it's quite a nuanced thing once you really get into it. So it's different methods work for different things.
Right. Okay. That's fantastic. That's actually a lot of information. Is there any last pieces of advice you'd like to give students today?
I think so. I would probably say I would be looking to always. So one of the things I would say, not necessarily as a student advice, but sort of generally, so like the Pods Heals campaign, the things I'm trying to do in the clinic, even talking to you, my aim is to always provide a win-win. I don't see that there's any competition within podiatry, or I don't really believe in competitions generally for that sort of thing in terms of trying to put, it's not as you'd say with Trump, a zero-sum game. It's not I win, you lose. All right. So I would always approach something to try and have you do well out of it, obviously, the patient do well out of it, the profession do well out of it. And there's always an option that allows everybody to gain. So I would say every time you come across a problem, try and look for that win-win-win situation. So there's usually one. You sometimes just have to take a step back and look for it. Okay. So, and I think if any of your viewers are interested, we could put on a Zoom heel pain talk if there's something that they'd be interested in. Some of the content that we put together for the Pods Heals campaign, that's obviously already in existence. So I could host something like that. We've got a Zoom. I think what can you have 100 odd people on a Zoom or something?
I think that's the limit. Yeah.
Yeah. So it's a format I've got used to a little bit over this period. So I do talks for Pilates organisations, again trying to promote podiatry as a thing for that, as well as sort of other sports therapists and yoga teachers and that sort of stuff. So we're trying to promote us to other professions so that they're thinking of us too.
Wow. Well, that's such a great offer. I'll definitely pass that forward. I know a lot of students will take you up on that.
If they message you with details or just a message, I don't know whether you put this on. I know it's on YouTube, but wherever you put it, if they comment underneath it or PM you, and then we can sort something out maybe.
Yeah, that would be amazing. Oh my God. Well, thank you so much for that offer, and thank you so much for talking to me today. I know I've picked your brain a lot and about a lot of things. I hope you have a good rest of your day. Thank you so much. Bye-bye.
You too. Have a lovely time.
Bye.
Bye.